Just imagine for a minute if you could improve the quality of your life while reducing the cost of your medications. In 2021, I was in a situation that most of us my age find ourselves in, helping my dad as he was aging and struggling with his health care. My dad was taking 12 to 14 medications a day, and the chance of that getting out of sync was high, and the costs were an ongoing burden. And then he fell and broke his hip and 2 ribs. And during his transition of care, his medications got out of sync, and this led to ongoing medical problems. It was a very difficult time after then. After spending 2 decades in healthcare and being fully aware of my dad's situation, I realized that he needed a custom medicine intake regimen that would be easier for him to manage and less prone for him to get out of sync. The world around us is going custom. We have customization in every part of our life and in our health. We have customization in our cars, our shopping experiences, our clothing, and our healthcare is becoming more customized too. We have a say in the doctor we choose, how the doctor communicates with us, how we view our information and our health portal. Even Forbes magazine says the world is going custom and customization is king. So why would our medications be left out? We're all familiar with the top 2 tiers of medications in the US today, brand and generic drugs. But there's a 3rd tier that's taking shape right in front of us that's providing affordable, quality medications made with high quality and purity standards shipped directly to our door. And it's a good thing because many Americans are struggling with the price of healthcare in the United States. The 2023 Commonwealth Fund Healthcare Affordability Study found that 51% of Americans are struggling with the price of their healthcare, and the rest can't afford it at all. One area that has been widely discussed is the price of medications. And Big Pharma plays a critical role in the price of the drugs that we all take. When a medicine becomes popular in our society, and we're seeing this with some of them that are available today, it's in the news today, Big Pharma companies can raise the price of that medication and extend the patent for another decade, keeping the price of that medication extremely high for those people who can afford it, that need it, and completely out of reach for everyone else. But there are other options that are on the table, because once the drug becomes generic, or it loses its patent and becomes generic, then the price starts to fall. But the disruptive option that I'm talking to you about today is really the compound pharmacy. Most of us are familiar with compound pharmacies. It's not a new thing, but it's taking shape and it's worth talking about because it's a great option for all of us. Compound pharmacies, or compounding medication, has been around since the 19th century. And by 1930, 75% of all medications were compounded in the United States. They were purchased by patients. And in the decades that follow, compound medications gave way to higher-priced commercial drugs. But we are all familiar with compound pharmacies. We have compound pharmacies in our neighborhoods. These pharmacies are owned and run by highly skilled, licensed pharmacists. And any one of us can walk in the store and talk to the pharmacist about brand, generic, homeopathic, compounded medications, and that pharmacist can sell directly to the customer. That pharmacist is operating a licensed 503A compound pharmacy. And since 2013, the FDA took a drastic step with compounding medications under the Drug Quality and Safety Act to increase patient safety and reduce risk to all of us. The FDA created the 503B compound pharmacy, and its intent is to increase drug manufacturing in the United States, which we are deficient today, and increase a higher standard of quality in those drugs that are being manufactured. Since 2013, more 503B compound pharmacies have come online and increased the capacity that we all need. And that continues to take shape today. Now, one of the benefits of a compound pharmacy that are worth mentioning, first is quality. If you're going to put a medicine in your body, you want to ensure that quality standards have been taken to make sure that it was created properly and that it's pure and you understand what it is. So the FDA oversees quality, ensures quality for all pharmacy in the United States. A 503A is required to comply with USP manufacturing guidelines. That's United States Pharmacopoeia standards. A 503B compound pharmacy must comply with GMP standards, which is good manufacturing practice. GMP is exactly the same standard that the big pharma companies must comply with. This ensures that the products that we're purchasing to take and put in our bodies are of the highest quality and purity standard. The second benefit of a compound pharmacy is customization. It's the very thing that makes compounding unique. This is the only way that we can get a medication made for each and every one of us. Otherwise, you're buying a brand or generic drug that's been made in a factory somewhere. But customization is the very thing that's special. Is that the drug is made from active pharmaceutical ingredients to our specific requirements, to the script written by the doctor, and nothing else is in it. So it's very pure. As an example of a customization that can be done, take children, for instance. If a child is prescribed a pill form and he doesn't like it or doesn't want to take it, a compound pharmacy can make this medication into a liquid form and add a flavoring to it for the child so it's more tolerable and increases adherence. And for women, we're all familiar with bioidentical hormones. That's a prescription written specifically to the woman's needs for optimal hormone health and ensures a higher quality of life. And then the third benefit I want to talk about is affordability. What's unique about compounding medications is that the compound medication, the pharmacist or pharmacy gets the active pharmaceutical ingredients directly from the manufacturer, compounds the medication, and ships it directly to you, cutting out the middleman. So with a prescription, with generic and brand name medications, there are a lot of middlemen in the way. This is almost like a direct-to-consumer manufacturing cycle. So most of the time, a compound pharmacist can create that drug specifically for you at about a third of the price. One of the drugs that's popular in today's society is the GLP-1 inhibitor weight loss drugs. You've seen the commercials on TV. Compound pharmacies are making these drugs from the active ingredient, and the active ingredient only, at about 25% or 30% of the price of the commercial drug, creating access to those people that really need these drugs. Access is the next thing I want to talk about, because in order for us to gain access to medications like this, we need to work with a doctor. The doctor has to write this prescription just like with any other medication. The doctor can write the prescription specifically to your needs. If there's an allergen in a commercial drug that needs to be removed, the compound pharmacy can remove that allergen if it can be identified, and you're taking just the pure medicine that you need, typically at a much more affordable price. Now, if we look to the future of what preventative health could be, today we have access to our DNA. We know how much exercise we need, how much water we need to drink, quality of foods that we need to sustain us nutritionally. But still, if we go test ourselves, probably every one of us in the room is deficient in something. Could be a vitamin or a nutrient. Just imagine if we were to create a unique pharmaceutical compound tailored to each one of us. Could we improve the quality and longevity of our life? Now, reflecting on the situation with my dad, I know now that my dad had other options available that would have been easier for him to take his medications and could have improved the quality of his life and the longevity of his life. So talk to your doctor and see if there's an option available for you. There are options out there available for all of us. Thank you.